Well, hi, welcome back to Facebook Live. I'm Dr. Annette Mercatante. I have with us...
And I'm Justin Westmiller, the Director for Homeland Security and Emergency Management.
And as usual, we're here to give you a brief update on the state of the county as it relates to COVID, and then to answer your questions. So send your questions in to us. We'll try and get to all of them, or as many as we can. So our COVID update today, the status report is, you can see we're up to a total of 995. We're getting close to that big 1,000 mark, but we're continuing to grow at a steady and slow pace. Our rates continue to be in that moderate zone with a less than 2% positivity rate. We are seeing a little bit of shift to cases, so we'll expect to see some increases gradually, I think, over the next week. But as of now, no red flags suggest that we're going to just spike up into an uncontrolled growth rate. So keep your fingers crossed, and of course that's what we're working so hard to do out in the community with the schools, etc. Is we're really trying to avoid that spike. One of the big pieces of information today, though, is we do have some new deaths to report. Three new deaths, and so our lucky streak is not over, but you know, I have to say we expected this. When you have cases, a percentage of those cases are going to get more ill, and a percentage of those are going to pass. So our condolences to those families if you're watching or if you know of who they are. So next we have our ongoing epidemiology graph. You can see again that last curve upwards. That's where we are now. Where it will go, we'll find out. But again, you can see that we're really not growing to that same trajectory that we did back in March. I hope we never get there, and certainly not to where we were in July, right after the 4th of July holidays. So hopefully we'll keep a cap on that. And then our percent testing and our percent positivity. As I mentioned before, we're not seeing an increase in percent positivity, and we are keeping our testing up over that 200 mark. Would you tell me the minimum amount of testing? About 200 to 240 is the least amount of tests we want to do in order to make our percent positivities a somewhat reliable number. So it's all about statistics, but if we can keep that number of testing up, it means that we can rely on the percent positivity to some degree and tell us where we're going. And then of course our data dashboard, where you can get daily updates and kind of see where we're at. Regionally, our region is continuing to do pretty well. We do have some hot spots in the state that we have to be concerned about. The Upper Peninsula is actually struggling a little bit. Ingham County, so we're certainly the areas where we have some of these colleges and universities is where they're seeing some increases. And again, that's not the activity of the virus, it's the activity of the humans carrying the viruses. So we would expect to see that when people are doing a lot of things together without our masks and our social distancing. So with that said, I think we'll go right ahead to our questions and see if anything's going to come in.
Doctor, we want to talk a little bit about the community flu.
Oh, I should.
Yep.
Yeah, so we're gearing up for flu season. Flu season can hit anywhere between November and March, so we want everyone to get their flu shots by the end of October. And we're going to be out in the community this year with flu clinics for you to sign to go and get your flu shot. So we're trying to make it easier for you to get your flu shot. And the first 3 are scheduled September 25th, tomorrow, and the 29th, which is, which day? Tuesday. Tuesday will be at the Lake Huron Medical Center main campus, and we do want you to register on our website so that we know how many people are coming, and that'll be a simple drive-through process. So that's another reason why you should register first, so we can get everything all taken care of and keep things moving. And then Tuesday, October 6th, we'll be at the Lake Huron Medical Center North Campus. So those of you living up in Fort Gratiot in that area, that would be a really good place for you to go. So watch our website, watch social media. We'll be announcing where we're going to be, and when we're in your community, take advantage of it. Okay?
And some great things about that too. We do have the enhanced flu vaccine available for those 65 and up. We also have the flu mist available, so no needle for ages 2 through 49. I believe we also have the regular flu vaccine available. And do wear a short sleeve shirt if you are taking an actual needle-based vaccine, just to make it easier
And no cost to you.
Yep.
Don't forget. So insurances will be billed, but this is no cost to you. So it's a win-win proposition. It's convenient, it's effective, it's safe, and we really want you to be protected against this virus as much as we can. Okay.
One other thing I want to bring up before we get to the live questions is we want to keep hitting the COVID-19 support line from Community Mental Health. That number is 810-985-8900, or you can text them at 810-956-6335. You can also email them at covid19support@sccmh.org. Okay? And we'll put that in the feed after we go offline. Thank you all.
COVID fatigue.
Yep, absolutely.
Okay, should we start with one of our questions?
We actually have a question.
Okay.
Perfect.
Can you explain the latest CDC change of guidelines for masks, filters?
So the
Masks and filters.
Yeah,
I'm sorry.
I can.
Okay.
So it's not actually forced guidance. What they're talking about is they're recommending if you have a mask that has the ability to insert filter media in there, that you go ahead and do so.
Okay.
It's not a requirement. It's a recommendation.
Just saying that a better mask
Yep.
is a better mask,
That's
which
right.
we kind of have always known. We've always known that different kinds of material, different layering of material does a better job filtering out respiratory particles. And so,
Correct.
Yeah, I forgot about it. So they just came up with another level of
They did.
what's a better mask. So the bottom line, though, is masks are good. And any level of mask you can use does prevent some level of viral transmission. I've been hearing a lot in some of our podcasts in the medical world that the severity of an infection is also dependent on the dose of the virus that you're exposed to. And that's another reason why they think masks can be so effective, because even though you may get exposure to some viral particles, you're not going to get nearly the amount of the dose if you, and particularly if you and the other person both have masks on. So lots and lots of information that continues to support what we've been saying all along, is that masks are worth the effort and the pain and suffering. So
Right, and if you can get a 3-layer mask, that's always better than a 1-layer mask.
Mm-hmm.
So that's what the CDC is recommending.
I've always said to everybody, anything's better than nothing.
Correct.
Okay, so just keep up the good work with that.
All right, another question. Is there any rapid COVID testing in the county?
There is not, well, for the general public, there is no rapid COVID testing at this time. We're working on it.
We are working on it.
We want it here. It's just testing continues to be complex, and so our hospital systems do have rapid testing, but they're generally reserving those for their inpatients and their hospital settings. If you go on the state website for testing locations, there are some rapid testing sites in Macomb County.
Yep.
I saw one on 13 Mile. We have to look at that a little bit more. Maybe we get that question a lot, so maybe we should emphasize that. But do remember what kind of test you're getting. So the confirmatory testing still remains the PCR, which those are generally not the rapid tests. The rapid tests are typically antibodies or antigen tests. Antibody tests are not going to be helpful for you to know whether you've got COVID or not. If it's the antigen test, we do take a positive as a probable that you have the case and count you as a case. So just know what kind of test you're getting. And the other problem is these rapid tests are not necessarily getting into our system in the same way that they automatically get into the system when a commercial lab runs the test. Because a rapid test is just a little cartridge that the person's looking at after they put your specimen in. And so they're supposed to notify us within 24 hours. It's not a system that's like working like clockwork right now. So if you do get a positive test, ask for those results, keep them in your hands, and bring them to us. Let's take a look at it, because we need to know what kind of a test you had to guide you to the next step. So that's very helpful.
I will say, though, that we are continuously working as hard as possible to get new testing capabilities into the county as quickly as possible as they come available.
We are.
And so keep continuing to ask that question, because there will be new capabilities as we get better at testing and as new technologies become available to us. They are out there, but they're just not available to us yet. So thank you for that.
All right, Justin, will you take the first question?
Sure. So this month is National Preparedness Month, and one of the questions I received is, how do I make a disaster plan during the pandemic? Well, really, it's no different than any other time you make a disaster plan. You make a plan usually before a disaster, but you can make a plan during a disaster too. Basically, you create and prepare for different actions to stay safe. You get accurate information on how to protect yourself and your loved ones. You prepare to get certain things that you might need to keep yourself safe, like medications, prescriptions,
Dog food.
Your dog.
I don't eat dog food,
Right.
but my dogs eat a lot of dog
Your
food.
dog or cat or any other animal you have in your house, their prescriptions and any needs that they might have. Understand what your other family members might need. Have an action plan should you need to evacuate, things like that. So there's a lot that goes into it. Go on the FEMA website and search on the FEMA website for Disaster Action Plan, and there's a really great website on there, and follow that, and that will help you out completely.
All right, we have another question on the feed in regards to the rapid tests. How are you working to get these tests? Who are you contacting?
The question is, how do we get these tests and who are we contacting? Well, first of all, we call the location that the test was done at. So if a person doesn't know and can't give us the result, and typically if you have a printed result, that's the easiest. But we will call the facility that the test was done at. And sometimes that can take a while. Sometimes it takes us a couple hours to get someone to even answer our call. So it's not the smoothest system, as I mentioned. But we'll try and go to the source first and foremost.
Doc, will you take the first question?
First question is, why didn't I get a letter about the cases in Algonac schools? And basically, you're going to get a letter if you're a case. And if you are a contact of a case where we feel you need to quarantine, you're going to get a call. That's the system we use. So cases get letters, quarantines get a call. And anybody who hasn't gotten a letter or a call isn't a case and isn't a contact. Everybody else is good to go. So that's how we're working it, and it continues to work out. I have to say, both schools now, both school systems have really shown a great deal of preparedness. The number of students who were exposed as a result of cases were really not that many. It wasn't the whole classroom, so they're doing a great job with those strategies that we had talked about earlier about spacing and kids not all being lumped together. So kudos to Algonac schools and all of you guys. It's very frustrating, I know, to stop and start, but quite honestly, we're going to get good at this. I think this time went a little bit better than last time, and we're going to just kind of keep working on that communication piece, because I know that's what stresses people out the most, is when they're not really quite sure if they're part of it or not part of it. So we'll keep working on that.
Please remind people that they can drop their questions in the chat box first.
Please drop your questions in the chat box.
All right, next question for you, Justin.
All right, so this one is near and dear to my heart. Can I schedule a military honors service at cemetery or any local military cemetery? And the simple answer is yes. Services are available at all national cemeteries. Basically, the VA is working through CDC guidelines to limit the number of available attendees just because we're doing social distancing. Understand that there is quite a bit of a backlog right now, and they're working through that backlog, but they are scheduling services. So please get a hold of your local VA rep, and they will work you through the process.
All right. Another question for you, Doc. Who are you trying to get the capability of the rapid machine tests from?
From whoever makes the machines. So
Yep.
there's a number of labs and manufacturers that make these rapid machines up till
And we're working with
recently.
all of them.
Yeah, they were only allowed, the government was controlling where they went. They were limited in quantity. For instance, the rapid antigen machines right now, we know they exist, but they are only being allocated to very specific, to our nursing homes right now. So That's going to change, I think, as the access expands. But that's the bottom line: is the manufacturers have so many, and then the government controls where they go. They prioritize them.
Yeah, and I can talk a little bit more to that too. So in the beginning of the pandemic, March and April, the rapid PCR machine, or the Abbott ID Now machine, was being very tightly controlled by the federal government, and they were only going to the hot spots in the nation, and they've backed off of that now, and Abbott is now making that more available.
Well, they've had a chance to catch up in the manufacturing,
creating
et cetera.
more of them, correct. And so there is some movement there, and they now are creating an antigen quick test, which yes, they are, and the federal government has locked them up for that.
Okay.
So that is not available.
The tricky part of the tests is going to become not so much getting a machine, it's going to be how do you interpret each test, and how is it best used, because every test has its capabilities and its limitations.
Right.
They're not all made equal, and we have to be very careful how we interpret tests and how we use them. Otherwise, things can get way out of control, or we're missing a ton. And we need to figure that out.
All right, Doc, will you take the second question?
Second question is, if I work at a school, or my child attends a school that has a confirmed COVID case, do we need to get a test? And that's maybe yes, maybe no. Obviously, sick or you get sick, we absolutely want testing. That is the easiest way of knowing whether you have allergies or a common cold, or whether you have COVID. So please, if you're feeling ill, even mildly ill, absolutely test. If you're just going to a school where there's been a case, generally not. I wouldn't suggest everyone rush out to get tested. All that test will tell you is that you're negative for that particular day. It doesn't really give you any further. But if you've been somewhere where you feel that there's an exposure, even if it's an exposure that we haven't contacted you about, it's always a reasonable thing to get a test. So we don't want to tell people only get tested if you're symptomatic. If you're not having symptoms and you feel there's a concern, you've been traveling, you've done something, getting a test is just an extra level of comfort and security. Nothing's 100% guaranteed, but by all means, it's, when in doubt, go ahead and get that test.
All right, we have another question. Are you able to state the ages of the deaths from yesterday in St. Clair County?
One person was in their 60s and the other two were in their 70s.
So the question is, can we state the ages? And my informatics guy just told me one was in his 60s and two of the others were in their 70s. So it falls within, again, that same range of people we expect to have more significant problems with.
All right, Justin, the next question on your sheet.
So one of my questions is, what is the difference between quarantine and isolation? And we hear this all the time. And so 10 days after the onset of symptoms, correct?
When you're sick.
When
so
you're
isolation is when you have the virus and we know you have the virus.
And quarantine is those people who were contacts but aren't necessarily sick, and that's 14 days.
Right, so the quarantine is used for people who've been exposed, but we don't know if they've been infected yet.
Right.
As you know, just because you've been exposed to someone who's got the virus doesn't mean you're automatically going to get sick. But what we do is we quarantine those people, so those that do convert to a positive case, they've not been out and about exposing other people as well.
Right.
So, important distinction, and thank you for bringing it up, because the terms get used interchangeably quite a bit.
All right, next question. Can you speak on why hospital personnel are encouraged not to get tested?
Can I speak to why hospital personnel are encouraged not to get tested? I would not think that hospital personnel would be encouraged not to get tested. Not only do hospital systems have the capacity to test their employees and staff and patients pretty effectively, but they are a higher risk because they're getting exposed to people who are sick, and they likewise need to stay in the workforce. So if you could maybe send me a little bit more of that information, I would not expect that to be the case. And maybe there's some conversation there that has to be made.
So Doc, we had a question come through earlier. How does one get tested that has a sensitive nose and anxiety?
Okay, the question is, yeah, I see it.
Okay.
Yeah, it's a good question. So how do you get tested if you have somebody who's so sensitive that you come near them with that Q-tip, right? No way. I know, there's some things you just have to compromise with. And if you really need that test, you go in the throat. We will accept an oral pharyngeal sample. At the beginning, it's like, well, this is the back of the throat, or the back of the nose is the best. The anterior nares is next. But all 3 samples are now officially called adequate samples, and we would use the throat one.
All right.
Yeah.
Justin, will you take your last
Sure.
question?
How can loved ones safely handle belongings of someone who died from COVID-19? And so you can retrieve the belongings of a loved one who's passed away from COVID-19. Obviously, you need to handle it with some care. You should probably sanitize it. And when you're done dealing with the belongings, you definitely need to wash your hands, probably wash the clothing that you're wearing, and then move on. Everything is going to
remember
be
the
okay.
virus, probably after 24 hours, if there is aerosolization, that continues to be a topic, but it's gone. So in the room, and things on surfaces probably within 72 hours,
Right.
if not less. So another way is just say,
Let it
leave
sit.
it alone, walk away from the room, leave it alone, take care of your business, then come back and do it later. But you're right. You could also just make sure everything gets put down. Wear your mask, wear your gloves, and then when you're done, just wash your hands really well.
All right. Doc, you take the next question on your sheet too.
Number 4 is how many are in the hospital due to COVID. That we didn't report that. Last week that we reported, it was 1% of the hospitalizations, correct?
It's still about 1%.
Still about 1% of the hospitalizations. So we're not seeing a big hospital burden right now. Our hospitals are doing really well. Still getting called. I think some of our primary care doctors are seeing people that are coming in with COVID-like symptoms, but we're not seeing that big surge on the hospitals so far. So that's good.
All right. On social media, we had some confusion. People said, "Are you saying people with no symptoms cannot pass the virus to other people?" Can you clarify that?
Okay, no. So there's been a lot of discussion about that. Is if you don't have symptoms, are you as infectious as maybe somebody who's really ill? But the bottom line is we do know that without symptoms, you can pass the virus. You can. Whether it's more or less, or the risk is greater or less, that's still under debate. But we do know that asymptomatic people without symptoms, absolutely transmit the virus, which is why we're so about quarantining people. If that wasn't the case, we would only need to worry about sick people, right? That's why we're going after people who aren't sick. Not going after, but you know what I'm saying. We're trying to identify people who aren't sick that have been exposed, because we know that if they start incubating that virus and shedding that virus, they may not have symptoms to know that's the case. So absolutely, asymptomatic people can spread the virus.
And it's what makes this virus so difficult to get our arms around, right? So.
Do we have an idea of how many people are asymptomatic versus symptomatic? Is another question.
So in our county, I'll let Brandon look up what our data is, but I know nationally the numbers are anywhere from a third, and I've seen things as much as 50% based on the population that was studied. So a lot of people have this infection and are not showing classic symptoms, which is why it's making it so hard to manage this. This is why you guys are being put out and being told to stay home from school and being told to stay home from work. If it weren't for that asymptomatic transmission, we would be able to do this in a much more straightforward way.
And right now we're sitting at 15% of our confirmed cases are asymptomatic.
So according to our data, we're sitting at about 15% of all of our confirmed cases as asymptomatic or not reporting symptoms. So a little bit less. That means that people who are coming to get tested are people who are tending to notice they're not feeling really well. Okay.
Can you talk about, wasn't there a wedding in Maine recently where there was a big outbreak?
So the wedding in Maine was really interesting, and I bring this up not to scare people, but to show you that what we're doing is not just to scare everybody and to be that we're not overreacting. So there was a wedding in Maine that was just reported in my Harvard thing, and no, I need the first page. And it was an August wedding. It was about 65 attendees, which did exceed the attendee limit in Maine was 50. We have a little bit of different number, but it exceeded a little bit the maximum number of attendees. And out of that wedding, they have linked 175 cases and unfortunately 8 deaths. Interestingly enough, none of the deaths were people that actually went to the wedding. They were people that got infected from people who went to the wedding. So these are the kinds of things we're trying to control for. This is why we're doing all these things that make people angry. And it's because we don't want your gathering, your party, or your event, or your classroom to be the one that's linked to 100 cases and deaths of any kind. We just don't want that to be you. None of us want that, and I always think that poor bride and groom, what they must be feeling like. But yeah, that's a real story. It was just released. So I mean, again, it's not to scare people, but to show you that these things are real. They're happening all over our country, and we just need to take care of ourselves.
All right.
Okay.
This will be the last question, but can you talk through a little bit more about the mitigation strategies in the schools and maybe the back to school?
So what are the back to school strategies? And mitigation means something you do to reduce the risk, okay? So we're doing harm reduction or risk reduction strategies so that with our kids back in a building that they're not all going to get sick and we have to close the building down, etc. So it's really pretty simple. We want everybody to wear a mask. We want everyone to try and stay 6 feet apart or more. We don't want anybody coming to school who's sick. We want to make sure that if we do identify someone who's sick, that we get them out of there really quick. We test them as fast as we can, and if they're COVID, we draw that circle around their exposed individuals and find out who is within 6 feet longer than 15 minutes and try and get them out of the school as well. So again, we don't have this kind of domino effect of sick people. It's really that straightforward. It's the same issue with lunchrooms, the same room with sports, the same room with buses. We just need people to stay apart from each other, not breathing on each other, using their masks, and if they're sick, to stay home. It's really about that. Now there's all kinds of things and rules we're talking about, and we're trying to do it. But for instance, now this last situation, and I mentioned in Algonac, really the school should be commended, as was Port Huron, because there was not a lot of kids exposed as a result of these people being in school. They were in school before they even knew they were sick, so we can't control that. But once they're there, you've got to track back 48 hours, as we talked about, to do that contact tracing. And those individuals were not, it wasn't like the whole classroom. It's working, and we can do this as long as the rates in the community stay low enough where we just don't have dozens and dozens of people every single day that we've got to, get out of the school and do that contact tracing. So that's really what we talk about, risk reduction strategies.
All right, closing comments?
You go first.
Sure. So clearly, with the case uptick that we had today a little bit, that may be what we could see here for the next few weeks and months, just because we're having increased activity together in our schools and in our communities. So we need people to be extra vigilant as you're working throughout the community so that we can remain in the place that we are now. So I'm just asking everybody to work a little harder to keep what we have and to hold what we have. So you all are doing great. Keep it up. And to all the students and faculty that are in schools, you're doing a great job.
Thank you.
Thank you all. Keep it up. And let us know if you need anything or if we can help in any way. And Doc and I will be there to help you along with our staffs. And with that, I
how much time do I have?
2
minutes. Just one thing I think we should review. And again, thank you. I agree. This you guys are really doing an excellent job, and I know it's not easy. What is if you are told by us, or you get a call from the health department, or we're using this Trace Force organization, if you get a call and say you are an individual identified as being a contact of a case, that means you're quarantined for 14 days. And it doesn't matter if you go get a negative test. If you get a test day 2, day 5, day 7, you still have to be quarantined. That means you're not going to go out and play. You're not supposed to go to work. You stay quarantined for that 14 days. Now, if you're somebody who just decides to go get a test because you, as I mentioned, you went to a party, but you're not quarantined, nobody called you, you're not aware of anybody specifically who is positive, you just decide to go to get a test, and that test is negative, carry on. Good for you. Yep. Carry on. Use that as a guide. Remember I said, it's kind of like you have that extra cookie, but you don't have to eat the whole box of cookies. You can just eat the cookie and then pull back and start doing the right thing. So that's a common source of confusion. I get it. When in doubt, give us a call. Do that COVID-19 was it COVID-19 at SEC? No.
stclaircounty.org.
COVID-19 at stclaircounty.org, and we answer those questions every single day. And if you have questions like that, we try and get back to you the same day if we can. So use that resource as well. That's it. See you next week. Join us next week, Thursday, same time, same place, 3:30.
Thank you all.